The American Brain Tumor Association is pleased to welcome you to our webinar series. My name is Bree Salzman, and I'm a program manager here at the ABTA. I want to send a big thank you to today's webinar sponsor, Servier, for their support of this program. As a quick disclaimer, the American Brain Tumor Association provides this information as a service. Information provided by the ABTA is not a substitute for medical advice, diagnosis, treatment, or other healthcare services. This information is not intended to replace discussions with your physician, and the ABTA strongly suggests consulting your doctor or other healthcare professionals regarding your particular needs. I've been looking forward to today's topic and speaker for a while now. We've been working behind the scenes for probably a couple months to pull this together for you all. Today, Dr. Kelly Braun will be sharing about returning to work after a brain tumor diagnosis, and she has specific expertise in this, not only because she's a neurologist, but she also has a personal story to share as well. Dr. Braun specializes in neuro-oncology and is an assistant professor in the Department of Neurology at Barrow Neurological Institute. Her expertise includes the diagnosis and treatment of brain tumors, and she became a neuro-oncologist because of her personal experience of being diagnosed with a brain tumor, specifically a meningioma, the year before she started medical school. Talk about timing. Thank you so much for joining us, Dr. Braun. Take it away.
Thank you very much. My name is Dr. Kelly Braun. I'm a neuro-oncologist at Barrow Neurological Institute in Phoenix, and I'm kind of uniquely suited to give this talk because I'd been diagnosed with a brain tumor almost 20 years ago now, and it's kind of the reason why I became a neuro-oncologist. So I know what it's like to go back to work from both personal experience and because of the patients that I've helped deal with this as well. So, learning objectives for this talk are to understand common challenges brain tumor survivors face when returning to work, including physical, cognitive, and emotional factors, and then also to identify practical strategies for managing work-related fatigue, brain fog, and stress, including ways caregivers and families can support the patient's transition back to work. So, as I mentioned, my story begins about 20 years ago. It was in the fall of 2007, long before I knew anything about brain tumors or neurology. I had just been accepted to medical school, but in the world of admissions to different programs, sometimes you get accepted to something, but then it's a few months before you actually start the program. So that's kind of what happened with me. And so I needed a job to fill in the year before I started medical school. And so I started working as a dosimetrist in the radiation oncology department at Mass General Hospital in Boston, just to bridge that gap. And so the picture here is one of the famous statues in the Boston Common, Make Way for Ducklings. And so it was shortly after I started my job at Mass General that I started to notice the gradual onset of some weird symptoms that I didn't really relate together. So some of the symptoms that I was having were numbness at the very tip of my tongue and at the corners of my mouth, restless legs, like I'd be sitting in bed and my legs just feel kind of crampy and uncomfortable. I started noticing that it would take me a longer time to eat meals, and I had to take more sips of water between meals, and also that I would start hiccuping after eating dry foods like dry chicken or couscous or something like that. Also, I started coughing on drinks. You know, when you swallow something down the wrong pipe, it just started happening more often. And then I would just get some dull headaches towards the back of my head on occasion. And I thought that might have just been from staring at a screen for too long in my job. But I finally went to see a neurologist who ordered an MRI, and lo and behold, I was diagnosed with a meningioma. And so this meningioma was a pretty big meningioma. It was the size of a golf ball. But also, as we say in neurology, it's all about location, location, location. And this meningioma was pushing into my brainstem and was causing all the symptoms that I was having. And so I needed to have surgery to remove this tumor, but the surgery was pretty involved. So it took place over 2 days. So the first day involved actually creating the approach to the tumor because the surgeons had to go in above my ear and take out some bones of hearing in my inner ear and also part of my vestibular system. And so my neurosurgeon had told me prior to the surgery that because of the approach that they were going to take to the tumor, that I was going to lose my hearing in my right ear after the surgery because you can't put those bones back. So the total time for that surgery was 6 hours. And then for the second day, it involved the removal of the tumor. They took some fat from my abdomen to put back in my brain after they went in there. And then I also needed a pressure gauge in my head to monitor for swelling. And so it took 15 hours in total. And so as can happen with major surgeries, it didn't go on without any complications. So at some point afterwards, probably within the day or so afterwards, I started to have some problems with moving my left side. And so they rushed me to the CT scanner, and it looked like there was a little bit of blood that hit just the right location in my brainstem and caused a whole lot of symptoms. So anytime blood interacts with neurons, it's not a good thing. Neurons don't like blood. And so let me tell you about the symptoms that I was having. Oops. Let's see. My slide. Sorry about that. My slides are not working with me here. Okay, I'll go back to sharing. Okay, so here were some of the symptoms that I had after the surgery. So I developed left-sided weakness, and by weakness, I mean I couldn't move any part of my left side. It was completely limp. I had some double vision. So this was because the tumor was attached to one of the nerves that controls the movement of one of my eyes. I couldn't speak or swallow because the bleed had affected some of the nerves that control the muscles in my brainstem. Of course, I had some ringing in my ears, some tinnitus, and of course, the inability to hear in the right ear because of what I had been told about from the surgery. And so I had to get used to this constant buzzing in my ear that started ever since surgery and is still going on today. And then also because they had to take out some parts of my vestibular system, my balance is totally off, and I had to retrain my ability to balance myself. So I had some definite hurdles to overcome with all this. So I had to go through speech therapy. It was very frustrating to not be able to communicate effectively. So I knew exactly what I wanted to say, but I just didn't have the ability to say it because my vocal cords weren't working and some of the muscles in my mouth to form the words weren't working. And so I would say things and people wouldn't understand me. And so I needed a couple of things related to this, related to the swallowing problems. At first, I had an NG tube, which is a tube they put down your nose that goes into your stomach. And then I had to have barium swallow test to test my swallowing function. And then I eventually had to have a G tube placed. Then I had to go through physical and vestibular therapy. So the vestibular exercises were to help me to make my eyes not bounce around all over the place and improve my balance. And then also I needed strength training to build back the strength on the left side of my body to be able to walk again, to be able to do everything on my left side. And then occupational therapy too, to regain fine motor control of my left hand. And so after the hospital, I had to go to a rehabilitation hospital where I had physical, speech, and occupational therapy. And so I had been in the hospital for 2 weeks, and then I was in the rehab hospital for 3 weeks. And so while I was in the rehab hospital, I went from using a wheelchair to moving on to a walker and then just to using a quad cane, which is the kind of cane that has those little feet on the bottom. And so I had to retrain my ability to balance without now having my vestibular system. So just relearning how to balance. I went through pretty intensive speech therapy so that I'd be able to form words again and speak again, and then also worked on swallowing and eventually eating. They also worked with me on cognitive exercises just because, I was so scatterbrained after the surgery and everything that I had been through. So occupational therapy, we worked on fine motor skills and then just daily tasks that you would need in life, like dressing, showering, brushing teeth, and opening containers. And I was also enrolled in an occupational therapy group with other patients that met every day and we discussed these kind of issues with the other patients. So everything just happened so fast, and the emotional impact of this really hadn't hit me until the deficits that I had started sinking in. So that was probably about like, a few weeks after my surgery, so about 1.5 weeks into my stay at the rehabilitation hospital, that yeah, I was just really bummed out that I was there, that I had all this weakness, that I couldn't do things and be as independent as I had been before. So I had a couple frustrations that led to my emotions. So one of them was boredom. So because my eyes were bouncing around everywhere and I was weak on the left side of my body, there really wasn't a whole lot of things that I could do to fill my free time. I couldn't watch TV. I couldn't use my laptop and type. I couldn't read books because my eyes were bouncing all over the place. And so the most interesting part of my day and week became waiting to go for a medical test or awaiting visitors. And then losing my independence. So, um, because of my weakness, I really wasn't allowed to do anything by myself. So I had to wait for nurses to help me to the bathroom whenever I had to go, which if you gotta go, it's not too pleasant to have to wait all the time for somebody to help you up. And then I had to walk at the pace that the therapist wanted me to, not at the pace that I wanted to. So I wanted to go back to being able to walk at a reasonably good clip, but they wanted me to slow down, take my time, think through all of my steps just so that I wouldn't have any falls. And so I was envious of other patients that I would see in the hallway who were able to walk on their own. So I felt, I didn't have anyone to compare myself to. I didn't know anyone else my age who was going through something similar. And so it seemed to me like my recovery was taking a really long time. But, now looking back on it, based on the location of where my tumor was and the extent of the surgery that I had, I recovered in a pretty good amount of time. But back then, it just felt like, why me? Why do I have to have all these deficits and go through all of this struggle to regain everything? So there are some things that I found that were especially helpful with keeping me going, just because it's hard to manage all these emotions and the disappointment that you have when you're going through a struggle like that. And so I found that visits from friends and coworkers and visits from my parents were really helpful, and that I was really, really lonely when I didn't have anyone around because I really couldn't do too much else. And I found that encouragement from my parents, family, and friends were really helpful. Even if it was just a little thing that they said, like, "Oh wow, your speech is getting clearer. I can understand you better," or just making little comments about my progress was helpful to give me more motivation as I was going through this. And then I really missed my cat, and I was so sad that I couldn't see my cat while I was in the hospital. And so I was so happy that my parents were able to bring my cat Soba in the picture here to visit me while I was there. And so after I was discharged from the rehabilitation hospital, I had an in-home nurse who came, and then in-home speech, occupational, and physical therapy, and then transitioned to outpatient therapy at the rehab hospital. And I was in outpatient therapy maybe for a couple months or so. Um, I had mentioned before that I had a G tube that was placed to help me swallow. So By the time that I was discharged from the rehabilitation hospital, I was able to eat on my own and didn't need the G tube, but it had to be left in my stomach for a few weeks before they could safely remove it. So I was so happy to have it taken out because it was just this thing that was wrapped around my body and that really annoyed me. And so I returned to work about 3.5 months or so after the surgery. So it was longer than I had anticipated that I would have taken, but considering everything, the extent of the surgery, the complications and everything, I think that 3.5 months was a pretty good time. And so the deficits that I still continued to struggle with, the speech was improving and was less and less an issue. I still had some double vision from that injury to the nerve affecting the muscle in my eye. That did improve over time, though, and my vision did improve. But it was really kind of frustrating to have the double vision for a while. I had some diminished sensation on my scalp over where my incision is. And so, for anyone who's ever had brain surgery out there, it's kind of a strange feeling if you feel over where your incision is because you don't have any feeling there and it doesn't feel like it's your own head. It feels like you're just knocking on a coconut or something and it's not your actual head. I had a scar on my abdomen from where they took out the fat to pack in my head. I couldn't hear in my right ear, and so that took a bit to get used to. I had that ringing in my ear, and so that was just an annoying thing that I had to get used to, and it made it difficult to sleep at first. And then the left side weakness and balance was gradually improving during this whole time. And then also I had to have frequent MRIs after the surgery. And as a lot of my patients and people who've been diagnosed with brain tumors know, there's some anxiety when you have a scan. You wonder if your tumor is growing back or if there's anything wrong in your head. So that's what I call scanxiety. It's a pretty common term out there, but just that anxiety of wondering what is on your MRI. And so finally returning to work after 3.5 months, my job at Mass General was pretty accepting of my absence and understanding of my deficits. And so my transition back to work there was fairly straightforward. But I also had the hurdle that I'd been accepted to medical school. And I was so sad that I was supposed to have started medical school only a couple months after my surgery. And since I hadn't fully recovered adequately enough by that time, I ended up having to defer for 1 year. So I just stayed in my job at Mass General for an extra year. And it worked out with when I started that I could defer. But obstacles that I had to overcome during that year was just adapting to the hearing loss. So adapting to social situations was the hardest thing, and it still can be challenging for me. So if I'm in a really noisy room and I'm trying to pay attention to a conversation, it can be really hard to hear the other person. Or like if I'm standing at a bank of elevators, it can be hard to localize which elevator goes off and which one I should walk to. And then driving again, this isn't really something related to my brain tumor necessarily, but I hadn't been driving while I was living in Boston. I would just walk everywhere, take public transportation. And so I'd kind of gotten out of the practice. And so I actually ended up taking driving lessons to be able to brave the roads in New Jersey when I went there for medical school. So I wanted to touch upon some general patient considerations for the return to work. So some deficits that patients might have could be physical weakness, like I had, some sensory problems with either vision, hearing, or touch. Some people might notice that they have some cognitive problems. Short-term memory problems are very common in brain tumor patients, and also just problems with processing speed. Communication problems, like the ones that I had that with having trouble with forming the words and getting them out, with enunciation of words, or also some people might have aphasia, which is problems of thinking of the words to say, like having word finding difficulty or even maybe a little bit worse. Fatigue can be an issue for patients when they're considering returning to work. And then also transportation problems. So, for example, some people with brain tumors, they've had some seizures. And when you have a seizure, per state law in certain states, you can't drive for a certain amount of time. And so they would need to find alternate ways of getting to work if that's the issue. And then other considerations for returning to work are the impact on financial conditions. So some people who are diagnosed with brain tumors might be the breadwinner of the family, and so it might be really important to the family that they return to work, and that can be a lot of pressure. Consideration about quality of life. So, for some people, going back to work may be really hard on them and might really affect their quality of life. And so that might be a consideration for them. And then also, will ongoing treatment be required? So for some patients with brain tumors, they might need chemotherapy and radiation, and that can possibly affect how they feel while they're back at work. Are they going to feel more fatigued? Are they going to need more time to go to these treatments? So those are some considerations. And so the American Brain Tumor Association published a guide of returning to work after a brain tumor diagnosis. And so you can find this on their webpage if you search for it, but I just have a few things that I copied from that guide that are helpful to consider. So I should mention that laws and rights can vary by state and country, and patients are encouraged to look more into local legislation to learn more about that. And a good starting place might be to reach out to a social worker or nurse navigator that you're working with. But reasonable accommodations can generally be grouped into these categories. That you might want to talk to your employer about changes in your work schedule if you need to, like having more flexible time with your workday, or maybe doing telecommuting so that you don't have to drive into work. You might want to think about changes to your workspace. So, for example, if you have weakness on one side of your body, do you need any special accommodations to help out with that, with typing? Or do you need a different chair that's more ergonomic? Concerning technology, are there any certain pieces of technology that you would need to help you do your job better, considering any deficits that you might have? Changes in workplace policies. So, is there anything in particular that you need to wear to make yourself more comfortable, or do you need any more breaks for any particular reason? Do you need to shift your job duties to maybe something not as important, in relation to other employees, or maybe even moving to a vacant position if one is available, thinking about changing exactly what you're doing for work. There was a study that was published in 2021 that included a group of 60 patients with gliomas and meningiomas and looked at this exact question, what proportion of patients in each group was able to return to work? And so the study found that 61.3% of patients with a meningioma and 31% of patients with a glioma were able to resume their previous job after a mean time of 3 months or so from tumor resection. And so among people returning to work, fewer than half of patients with meningioma and most patients with glioma changed their working tasks and reduced working time. So a greater proportion of patients with meningiomas were able to go back to work, but still there were some patients in this overall group of patients who had to change working tasks and working time to accommodate them. So my story doesn't end there. So there was a small piece of the tumor that was left behind because it was in a very vascular area that was difficult to get to. And so this was watched over time. I kept getting MRIs every year or two just to track this. During my fourth year of medical school, which was in February of 2013, my radiation oncologist said to me, well, it looks like that little area of tumor is growing a little bit. You might just want to come in and have radiation done like right now as opposed to later, because you might not be able to get a block of 6 weeks of time to have the treatment done. And so I went back to Boston for the 6 weeks of radiation treatment. So this is kind of what that looked like. So I was set up in the machine there, and they had to turn me on my side in order to get some of the treatment. And So it was really important to me during this time to take really good care of myself so that I would avoid side effects. And so I made sure to sleep really well. I just listened to my body and let myself sleep for as long as I needed to. So it was probably maybe 8 hours a day. That I also made sure to eat nutritious, well-balanced meals. And then I also made sure to exercise too. So I joined a yoga studio and tried to go almost every single day. And then I also did some small group fitness classes where I was staying. And so I was thankful that I didn't end up developing any side effects from treatment. And I actually felt really great due to my focus on wellness, which was probably more focused than I had been paying attention to or allowing myself to have during medical school when I was just so focused on studying all the time. So fast forward to my next hurdle. So over the next few years, brain tumor is totally stable, and so I was able to complete medical school, do my neurology residency, do a neuro-oncology fellowship, and then got a job where I am now at Barrow as an attending physician, and then I even had a baby. And so I continued to undergo regular surveillance MRIs and tumor is stable, and so to this day my tumor has not grown back, fortunately. But then a couple years ago, I started to notice some new vision problems, and that seemed kind of weird. So it felt like I had a bright spot on the left side of my vision that was just kind of slowly developing over a few weeks. And so what ended up happening is that I ended up bumping up my MRI, and what it showed is that there was a very rare complication of the radiation treatment that I had received. It was a radiation-induced cavernous malformation that bled. So that black spot there that you can see on the CAT scan is the bleed. And so it wasn't small, and it was exactly what was affecting my vision. And so I came into the hospital and met with some of the neurosurgery team, and they recommended brain surgery to remove the hemorrhage. And so I had to undergo a second brain surgery. So brain surgery, it's kind of a big deal. It's pretty scary when you're thinking about it. And fortunately, it went really smoothly, and I was able to go home within a couple of days, and I didn't have any major deficits from this surgery. But still, I ended up taking 6 weeks off from work to recover from the surgery. And then, so during that time, it's not like I was just sitting at home. I mean, I had a lot of doctor appointments, and something about brain surgery, if it's the anesthesia or maybe just going into your brain, I just felt kind of cognitively slower for the first couple of weeks afterwards, and that improved slowly over the course of the 6 weeks. And so I was fortunate to not have any major physical deficits after the second brain surgery. It was maybe just a little bit of left-sided weakness that improved pretty quickly. And then also the vision deficit that improved over the next few weeks. But my biggest hurdle this time to returning to work was psychological. So something that I think is really important to consider, that might be the white elephant in the room, that people don't always talk about, is people are going to want to support you to go back to work, but then in your job, there might also be some people who are wondering if you're able to perform at the level that you had in the past. And, they kind of watch you closely. And so it can help to talk to a therapist or coach or your family members to help to support you through this. But it's definitely a challenge. It's definitely a hurdle to overcome. And I don't know that I really have any good strategies necessarily, other than talking to coaches and everything. I think you just have to prove over time that you're able to do your job diligently, and that you're able to be as efficient as you had been. And if not, then you talk to your employer about making changes and accommodations to help you perform at a level that everyone is comfortable with. And so I'll segue into ways caregivers and families can support the patient's transition back to work. So they can support them through emotional and reassurance. So they can help with feelings of anxiety, frustration, and depression, which are all natural responses after having brain surgery, especially if you have deficits from the surgery. They can give emotional support and reassurance, which is extremely important for managing these emotions. And they can help by providing encouragement and understanding during challenging moments. Caregivers and families can help with managing daily duties. They can help with things like childcare, household chores. That'll help the patient go to doctor or therapy appointments if they have physical, occupational speech therapy or whatever other appointments they have. And then also families and caregivers can help with focusing on long-term goals of the patient. So helping them to stay focused on long-term goals like returning to work or family activities that helps to sustain hope and determination. So I'll conclude by saying that there are a lot of challenges that brain tumor survivors face when returning to work, including physical, cognitive, and emotional factors. And I think that I've illustrated some of those factors through my own story. And I hope that that's really helpful that I've shared all of that with you. Some strategies for managing work-related fatigue, brain fog, and stress, and are what I've shared, including ways caregivers and families can support the patient's transition back to work. And so those are references, and I'll say thank you very much, and I will turn it back over to Bree.
Awesome. Thank you so much, Dr. Braun, for all that wonderful information, and especially about your personal journey and the lessons you learned about going back to work, not once, but twice. And everything that you had in place to support you along the way. I've been watching the questions coming in during your presentation. I'm going to open it up for those questions in just a moment. So please keep sending those into the Q&A box. But first, I do want to let everyone know that even if we are not able to get to your question live in our conversation today, we will be continuing this conversation in our connections community for the next couple days. Dr. Braun is going to be joining us there. There are always more questions than we have time to answer, so this is an added benefit to our webinar series. And when we're finished, we'd love to have you hop over to share your takeaways from Dr. Braun's presentation. And you can scan that QR code on the screen there to access the community. The link is there at the bottom, and then we also will include the link in our follow-up email as well. So keep an eye out. Lots of ways to join that conversation. So let's get to some of your questions. Like I said, I've been following through the chat. Dr. Braun, let's start with a first one, which is pretty common one. How do I even know what my needs are? How do I determine them in order to then express them to my employer?
I think probably talking to your doctors, and then also like if you're in therapies like physical, occupational, and speech therapy, having a conversation with your therapists and asking them what they think they need help with and what you might need certain accommodations with might be a good way to help you with talking to your employer about what you might need when you go back to work.
Mm. Yeah, that's a great idea. Yeah, absolutely. And so let's say that someone has spoken with their healthcare professionals, their occupational therapists, their doctors, their medical team, and gotten some suggestions, taken that back to their employer, had those conversations, but their employer isn't really working with them. Maybe they're unaware of their obligation as an employer to work with them, or maybe there's just a conflict in the work culture. So, for example, maybe someone needs to be able to work remotely, but their employer places heavy emphasis on in person, just as an example. The general question is, if someone experiences friction or pushback or resistance from their employer to make these accommodations for them, how might they address that?
That's something that if there's a human resources department, it might be helpful to reach out to them. Or this might be a question for you, Bree. Does the ABTA have like a social worker who might be able to help to navigate this question?
Hmm. That's a really great question. So, as you mentioned, we have the resource available in terms of the return to work, and we actually are including that link in our resource guide following this conversation in the email. So you'll have access to that brochure that Dr. Braun referenced during her conversation. As far as social workers on our team, we don't. However, the Brain Tumor Network offers a free nurse navigation program, which is amazing. And we highly recommend them and often give referrals to the Brain Tumor Network on support on that front. Yeah. Yeah.
Yeah, it'd
Awesome.
be helpful to find a social worker either through one of these associations or if there's someone locally who'd be able to help out with that.
Hmm. Absolutely. Another question here, are there types of programs or therapies that you might recommend for regaining executive function specifically?
That's a good question. And generally, I think talking to a speech therapist would be the first way to start looking into that. I know here at Barrow, they have some intensive rehabilitation programs that work on that kind of thing that are meant to help to transition somebody back to work. And so that would be included in that. And so you can look into like if there's a local place that has those intensive kind of programs or talk to some of the therapists that you might know, like physical therapists, if there are any programs.
Yeah, absolutely. Yeah, that's a really great starting point.
Mm.
This question actually has come through in a couple different ways from a few different people. So I'm kind of combining a few together for listeners. Um, Related to your personal journey, but also just in general, for you specifically, how long did it take in your recovery to feel quote unquote normal again, or feel like I've kind of got a handle on things? And start feeling like maybe I can adjust the accommodations or kind of work my way back up to the type of work that I was doing before. What kind of signals were you looking for?
I think to generally feel back to normal, it was probably once I had started going back to work. So it probably took that 3.5 months or so, because by then all of my deficits were improving. But still, I had the problem with, I felt like my speech wasn't 100% back to where it was. I was speaking slower and also adapting to the loss of hearing in my right ear. It took a little bit of getting used to. So I would say that I really started feeling normal from recovering from all of those things probably by the time I started medical school a year later.
Mm. Yeah. So, and I think it kind of varies from person to person is the
Exactly.
bottom line for this is, one person might need a few weeks to a month, another person might need a year. And to your point that you shared earlier, some people it might mean that they end up looking for different types of work that they can thrive in, that maybe the work they were doing before their diagnosis is something that they might have to let go of, which I know is very, very challenging because our work is such a big part of our identity for many of us. But that sometimes is on the table for consideration as well. Yeah. Um, Another question here. Do I have to disclose any of this to my employer?
Your employer might be wondering why you're out of the office for a period of time. So you, you might have to be careful about what you disclose to your employer and just you might want to just disclose the minimum amount of information. Like, I have to have a surgery. I need to be out for a few weeks to recover from it. But exactly, it's a good question because, if you tell people that you're having a brain surgery, then you might get the questions or people wondering of, are you going to be able to perform at the same level that you had before?
Yeah, absolutely. And this is another place too where your human resources department or your people team can be really handy on navigating this because they do have levels of confidentiality that they're required to maintain in terms of what is shared and disclosed, not only with your direct manager, but also your team members as well. So connecting with someone on the HR team can be really helpful on this front. The thing that to think about too on this front is, in order to receive some of the accommodations that Dr. Braun shared about, among others, there is a certain level of disclosure that will need to happen in order to receive these accommodations. Now, if you're in a place where you're not looking for any accommodations and you feel like you can do your work just fine, then disclosure becomes a different conversation and it becomes more of a personal choice than a need in order for you to be successful at work. So that's a place where I definitely recommend connecting with your HR office and having a confidential conversation on that front. And you can let your HR person know up right at the top of the meeting that I'd like to have a confidential conversation that stays between me and you. And at any point, if I share something that requires you to share it with someone else, I'd like for you to let me know so I can choose whether or not to continue the conversation. So that's an approach to take as well. So that way you can feel comfortable having that conversation and seeking guidance without risking that you're crossing lines where the HR person would have to disclose because they do have certain expectations on their end too. We've got one person, Dr. Braun, who is interested in knowing the cognitive rehab program that you participated in that you mentioned.
Oh, so in Phoenix, it's called the CTN program, so the Center for Transitional Neurorehabilitation. And
It's a
so
mouthful.
that's, yeah, I know. It's a program that's offered through the PM&R or the rehabilitation department here in Phoenix at Barrow.
Hmm. Awesome. Um, And then I know you did share that you had radiation, not chemotherapy, but are you aware of how chemotherapy might impact someone's ability to return to work or any information on that front, that treatment path?
Absolutely. So when someone has chemotherapy, they often are having, the brain surgery and then the radiation too, and then just the whole constellation of all of that can cause some cognitive problems. And so that might be a consideration for going back to work is that you might have some short-term memory problems because of all of those treatments. But then also, if you're having chemotherapy, generally it's well tolerated and as doctors are able to help to manage and minimize side effects. But some patients just say that they just feel more fatigued or that they have some nausea. And so they might want to incorporate that into their work schedule and maybe take time off while they're taking the chemotherapy in case they have those symptoms.
Mhm. Yeah, absolutely. Absolutely. Well, thank you so much. That's all the time we have for live questions, and we'll continue the conversation in our online connections community, like I mentioned. I'll put that slide up again so that you can scan that QR code and go ahead and hop over there. That thread is live as we speak for you to be able to ask additional questions. And as I mentioned, Dr. Braun will be joining us to continue to answer your questions, but also share your takeaways as well. And we also want to hear from you about this live webinar. Your feedback is not only helpful to Dr. Braun, but it also helps guide our future programming efforts. We are all ears on anything you'd like to share, so you can scan that QR code on your screen. You can go to that live link that's listed there, and then I also am going to drop into the chat for everyone that link for easy access. That way you can just click directly on the link in the chat if that's best for you. It should only take about 10 minutes of your time, and it really does mean a lot to us. In terms of upcoming events for the ABTA, our adolescent and young adult virtual meetup is on March 4th. That is a monthly gathering that we have. And once you register for one, you are registered for them all. It is a group that's specific for brain tumor patients and survivors between the ages of 18 and 39. We also have our next webinar already lined up on understanding cognitive and emotional shifts from brain tumors. We've actually gotten a few questions today about that, so I imagine a few of you will be interested in that. That is on March 24th at 2 o'clock Eastern, 11 a.m. Pacific, and we are kicking off our 5K season, starting with Tampa on March 28th. Registration for all of these events and programs is open, and you can go to abta.org, and we look forward to seeing you at any or all of these events. That would be amazing. And if you're looking for more resources from the ABTA, visit our website at the ABTA at abta.org, email us at info@abta.org, or you can call the care line at 800-886-2282. Thank you again to Dr. Braun for a great webinar. Thank you to today's webinar sponsor, Servier, for supporting this program, and a special thank you to each and every one of you for joining us today. We hope you found this information useful and relevant, and hope that you make it a great day.